available space. So when you want to do implant at any particular site, in for that matter, let that be anterior or posterior, you have to look for the space available. Space available between two teeth. Space available buccolingually or buccopalatally. Space available occlusogingivally, right from the occlusion of the opposing teeth till the bone or the oral mucosa. And finally, last but not the least, you have to look at the intraosseous site or a bone where you are going to place the implants. So let's begin with the mesiodistal space. So what happened? Why you need to understand this mesiodistal space? When you place implant, then definitely you have to put a crown on that. For that crown to come, you need certain space for the ceramic to come. So you need an interdental space for that. So when you are placing two implant next to each other, the total space required is 3 millimeter. If it is 4 millimeter, 5 millimeter, that's not a problem, but it should be minimum 3 millimeter. That also required because the bone needs to form there. The blood supply should not be compromised, and the interdental bone is required for the interdental papilla, which ultimately needs required for the cosmetic as well as the alike look from the adjacent teeth. How you will maintain this mesiodistal dimension? So what you have to do, first you have to measure on the model. Measuring intraorally is not that easy, but you have to measure on the model. So for example, you have planned an implant of size 4 millimeter, or for a 4 millimeter size of implant, you have to have 7 millimeter of space between two teeth, 1.5 millimeter on each side. And when you are planning two implant of 4 millimeter size, then if you look at this picture, for the 4 millimeter two implants, you need 3 millimeter bone in between and 1.5 millimeter on each side. So total is 4 plus 4, 8, and plus 3, 11, and plus 3, 14. So what is required is 14 millimeter of total mesiodistal space for this particular situation. So what you do, practice, take a paper and pen. You know, you have lots of models in your clinic. So select few of them and start practicing on them. You know, you might have given some crowns and bridges on that. So now you start calculating, do some practice like this. If the space is more than 1.5 millimeter on either side of implant, that is also fine. Up to 2.5 millimeter, that is absolutely fine. Now intraoperatively, when you will measure this, how you will measure, in our video of a kit where we have described to the kit, you will find this type of pin. So when you do your first osteotomy, put the pin inside, you will be able to see on the x-ray whether you are exactly in the center or not. Next, if you see this particular picture, it's very clearly evident. If you do not follow that 1.5 millimeter of minimum distance, then what is happening here? You have a distorted interdental papilla, and at the same time the crown contour is not proper, the crown contour is compromised. If the space is more, then definitely there will be over contour will be there, and in this over contour situation you have to manage the forces exactly in the center, not at the periphery of the crown.